Gord has had Parkinson's for many years and recently underwent deep brain stimulation here. Dr. Kalia implanted him in the subthalamus, which is targeting the brain. And this is the electrode of this stimulator in his brain. This is, for instance, in his right hemisphere of the brain. And now is stimulated with this strength, and we're going to see now what happens when we increase the stimulation. For instance, this is supposed to improve his mobility, but if we increase stimulation too much, you might have excessive movements that you will see in a second, that we call dyskinesias. You mind keeping your hands out and your legs out like this? So with more stimulation, he starts to have involuntary movements on his left, because we are stimulating the right side of the brain. This is clearly showing that the electrode is in the right spot, because we're giving him movement. But if we use too much stimulation, he has excessive movements, as you can see now on his right foot. So for this reason, we can fine-tune the stimulation and give him exactly what he needs. So if we reduce stimulation again to the setting he was at before, he will have better mobility without involuntary movements. But the interesting thing about this particular device that we implanted in Gord is that we can actually measure what's happening in his brain. We can detect the signal that you'll see in a second here. We can actually stream live from his brain a particular parameter that we call beta band. The more beta the patient has, the more Parkinson's is present. So this is something that's going to tell us how the patient does chronically. It's going to record even when he goes home. And when he's back to see us in the clinic, we'll be able to see how he was at home, which is a great revolution in our field, because we'll be able to chronically record the brain. And this is also preliminary to another type of stimulation that we'll be using in the future, that is called adaptive stimulation or closed loop stimulation, meaning that stimulation will adjust automatically based on what's recorded in the brain.